Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today I'm joined by Dr. Sabato, and we're here today to talk about AEDs. So my first question for you, doctor, is what is an AED?
Automatic external defibrillator. Many people have internal defibrillators because of various heart disease that they have, but this is an external defibrillator. Automatic means that it's a computer, and it will talk you through what you need to do to save someone's life.
I see them in many public places. Are they all the same?
They're all pretty much the same. The basic principles that they have to follow with talking through the key steps in that emergency are pretty much the same.
How do you use an AED?
Well, one of the key things is knowing what the symbol for the universal symbol for an AED stands for. That's really crucial. Even in the hospital, we have to be sure that that sign is there so that people can find an AED when they need it with things. So when you open a package from a defibrillator, they're all pretty much the same. This is a training device, and so when you bring a defibrillator to someone who's collapsed, there should be somebody doing CPR, and the CPR continues through you putting on the pads. And so when you open the defibrillator package, the first thing you take out is the pads, and the pads are all labeled and tell you exactly where they go. This one goes on the left side of the chest. This one goes on the right shoulder, and that's because it needs to go through the heart with the electric charge in order to help convert the rhythm. So once the pads are on, and in a emergency situation, they would be continuing to do CPR. You attach the pads to the device and then turn the device on.
Analyzing heart rhythm. Do not touch the patient.
And you stop touching the person because you don't want to interfere with the computer interpreting the rhythm.
Charging. Stay clear of patient.
So you stay clear as the charge. When the charge is ready, you yell out clear to be sure everybody's away, and then you press the button.
Shock delivered. Begin CPR.
And the computer, the defibrillator, will tell you through that rhythm, that's the rhythm to do CPR. So you're matching the beats from the machine. There are also some defibrillators will actually tell you whether you're doing adequate cardiac compressions with CPR, whether you're doing it deep enough, whether you're doing it fast enough, and whether you're in the right location. When someone collapses, the protocol is you call 911, someone starts CPR after they try and wake them up. They ask if there's a defibrillator nearby, and they send somebody to get the defibrillator.
How do I know if I should use an AED?
The AED actually, as a computer, once it's put on correct, will actually tell you whether it is to be used or not. And also, most of them will help guide you through how fast to do CPR and whether you're doing effective CPR.
Can you talk about your program in collaboration with the City of Worcester?
Take Heart Worcester is a program that we've started with the city where we're trying to increase the number of people who are taught CPR, especially high-risk people, and also increase the distribution of defibrillators, as well as teaching people how to use it.